First, let me extend my played a role in these difficult times. But this adversity has also opened up an opportunity for all of us, to present the strengths of traditional medicine in the management of communicable diseases like COVID-19. COVID-19 has emphatically exposed inadequacy and, if I may say, incompetencies of current health systems. COVID has also brought modern medicine and traditional medicine at the same level playing field, because COVID is new to modern science, as new it is to traditional medicine. But modern medicine or allopathy or traditional medicine, like Siddha, both have strengths and both have weaknesses. For example, when somebody is having a respiratory problem, of need for oxygen, we have to give oxygen. If somebody needs critical care, we have to admit in the hospital and give critical care. But for prevention or for mild to moderate management of COVID-19 or for post-COVID treatment, there are not many good therapies or treatments available in modern medicine, and traditional medicine can offer quite a lot. When we talk about communicable diseases, and especially infectious disease like COVID-19, which has newly emerged, when vaccines are still not fully ready, and the questions regarding their safety, efficacy, affordability, and availability remain yet unresolved, the modern medicine, when it has no proven safe, affordable interventions as of now, and modern medicine really cannot give you much to improve innate immunity. you know, Because in the COVID time, there are two things are important, especially when we talk about communicable diseases. The first is immunity, and second is inflammation. The whole thing is evolving around these two, and modern medicine can hardly offer anything to improve innate immunity, for example. While it has very powerful medicines to control inflammation, including corticosteroids or various anti-inflammatory agents, there are no agents which can really modulate immune response, because in disease like COVID, many times, especially when you are in early phase of infection, you may need immune enhancement, to protect viral infection. But when infection sets up, then it can lead to the exaggerated response or immune response leading to cytokine storm when you need immune suppression. So what is important is immune balance, and this kind of immune balance or immunomodulatory activity, there are hardly any modern medicines that are available which can do this. But traditional medicines, including Siddha medicines, have good medicines which can prevent the infection by improving our innate immunity, or it can also help in recovering faster after the COVID period is over, and these are very, very important strengths of traditional medicines, including Siddha medicine. Yoga has to be really integrated. If you are using Ayurveda or Siddha or Unani or other traditional medicines, yoga cuts across all of them. Yoga is needed, and yoga can improve physical as well as mental status. It helps in improving mental health and so the well-being, as well as the Swasthavrutta and Rasayana from Ayurveda, coupled with pranayama and meditation from yoga, can help prevention and better recovery. Siddha medicine also has many safer adaptogens or immunomodulators or disease-modifying agents such as Kabasura Kudinir, and we just heard how Kabasura Kudinir has helped, and I'm going to talk about it little later. So when the COVID was on the horizon, and we were yet to know what kind of disaster is in front of us, I'm talking about early period when COVID was just coming up. The Minister of Ayush took various proactive steps. Minister of Ayush established interdisciplinary task force, and this task force had various working groups, and these working groups came out with many new ideas, projects, and identified various collaborators, and also established funding mechanisms. And through with help of different councils, and I must tell you that Central Council for Siddha research also was very active, and they came forward with various ideas and various medicines. Kabasura Kudinir, of course, was one of them, and they also undertook various epidemiological studies, clinical studies, preclinical studies, including in silico studies, and a lot of data has emerged, and then systematic data analysis has happened. There was a very good team which was created. We also at the ministry level formed another expert group, which I chair, and through this we started mentoring our own scientists, because while clinicians have done excellent work, now how to convert that work into data, into analytic analysis, and scientific documentation and scientific publication. This requires little bit of help and mentoring, which we try to do with various experts. And so I can see that many new publications have emerged out of this. As far as Ayush is concerned, as you know, there have been several studies, out of which 126 studies, are planned and supported directly or indirectly by Ministry of Ayush at 150 sites, including 130,000 participants. So it's a very large number. Out of these, 66 studies were on Ayurveda, 13 studies were on yoga, 8 studies were on Unani, 26 were on homeopathy, and more than 13 studies were on Siddha medicine. And I must compliment the whole team of Siddha Medicine Council, as well as national institutes and other colleges, that they have done a wonderful job during this time. And I must tell you that the studies which have been undertaken on Siddha medicine, such as Nilavembu Kudinir and Kabasura Kudinir, has created a global impact. Not only in India, but many other countries also were happy to know the results of various randomized controlled clinical trials on these Siddha medicines. One of the clinical trial has reported that both Navavimbu Kudinir as well as Kabasura Kudinir showed a statistically significant reduction in hospital stay time, as well as reduction in viral load of SARS-CoV-2, and the time taken for patients to become asymptomatic from symptomatic also was reduced as compared to placebo. And in these studies, they've used decaffeinated tea as placebo. And the primary outcome measures of Kapasura Kudinir arm were significantly better as compared to placebo. So these studies actually have told us, or have shown us, that the role of Siddha medicine is extremely important in prevention as well as in treatment of mild and moderate cases of COVID-19. And there are studies now coming up in which they have shown that Siddha medicine also can be useful in managing post-COVID problems. COVID, we know that even if patients become asymptomatic, depending on the severity of the infection they have faced, they start facing lot of problems even after they become asymptomatic or they recover from COVID. And these have various range of problems, including cardiac problems, nephrological problems, respiratory problems, immunological problems, psychological problems. So all these problems are there and they need to be treated. So if Siddha medicine coupled with yoga, meditation, it certainly helps in improving the post-COVID recovery. And In addition, Ministry of Ayush also supported many studies in collaboration with Department of Biotechnology, in which we have shown that various ingredients of uh, formulations such as Ayush 64 and Kabasura Kudinir, they have also antiviral activity. And this antiviral activity was in fact many times was also comparable with drugs used in modern medicine, such as the antibiotics which were used, such as remdesivir. And this is very important. And the safety part of Ayush interventions is extremely important. And Siddha medicines, especially both Kavasara Kodinir and other medicines which have been used, have been found to be safe and effective. So the um, Ayush Sanjeevani mobile app, many of you may have seen it and enrolled it. Ayush Sanjeevani mobile app actually captured 15 million health seekers data, and from this data it was revealed that 85% of the respondents have reported that they have used some or the other Ayush measures for prevention of COVID-19, of which 89% reported that it was benefited, and several of them actually use Siddha medicines, and about 63% of the respondents reported improvement in general well-being and appetite, bowel habits, sleep, and mental status. About 75,000 physicians have reported utilization of Ayush measures for prophylactic and as add-on. As you know, that Ayush Clinical Repository also has been put now online. Ministry of Ayush website has it, and I would appeal that many cases, because we talk about randomized controlled clinical trials or observational studies and other type of clinical trials, but clinical cases also are important, and these individuals who have managed effectively in their own clinics various cases of COVID-19, I would appeal to them that they should deposit their experiences and data in this Ayush clinical case repository. It's not very complicated. You can just go to the Ayush Ministry website, and from there you will be taken to Ayush clinical case repository, in which you will be able to deposit your data. you know I would also like to inform that many publications have come out from these studies, and if you see how many of them were actually coming from the Siddha medicine, I was surprised to see lot of papers coming from Siddha medicine. For instance, if you go to Scopus, which is a reliable database, there are more than 25 articles, which are based on Siddha medicine interventions. Uh, and these are good journals, For example, Jose et al. Have presented in Journal of Hypnopharmacology, or Devi MSS have published in Siddha medicine in computer modeling. That was also a good study. The studies on Kabasara Kudinir, and most importantly, many of the clinical studies. I am happy that the Siddha medicine clinical trials protocols were published in good journal known as Trials, and in the same journal, results of these clinical trials also have been published. Srivastava et al. They have published both protocols as well as results of these clinical trials in the journal by Springer known as Trials. They There are other studies as well, and I'm not going to mention all of them. But even if I try to see how many of them were related to actual interventions, because there are many studies in which conceptual, hypothetical, or hypothesis-driven, or systematic reviews on Siddha medicine also have been published. But even if we look at interventional studies, I could see that there are about 15 good interventional study reports have been published in good journals. So this calls for a very good appreciation for all Siddha scholars. And I know that many Siddha students also must have participated in these studies. I would like to finally tell all the Siddha scholars that you have really done a remarkable work during difficult time in COVID when nobody was even ready to look at COVID patients. People were so scared. At that time, Siddha doctors have come forward and they have given medicines and have treated several patients in Tamil Nadu, especially, and also in many other parts of India. I compliment them and I wish that in coming years, when the new strains are coming up, Siddha medicines will be able to really first prevent infection by improving immunity of people and will be able to manage mild to moderate cases with Siddha medicine, as well as by taking yoga on board. Siddha medicines and yoga together can help post COVID recovery also. This is needed for our country, and I'm sure that the Central Council as well as National Institute in Siddha and many other colleges will stand to this major challenge which is before us, for which I give you my greetings and wish you all the best in this important exercise and effort which is being organized by all of you. I thank you for inviting me to speak to your colleagues and students. I hope to address any of the questions if there are. I have saved some time from my presentation with the hope that remaining time can be used as an interaction. I would also like to know from the participants if there are any comments or suggestions based on what